There was a time, a happy time, when I didn't know what sarcoma was. There was a time I had never even heard the word. That time ended suddenly in May 2015, when a doctor said to my 18-year-old daughter, Ellinor, you have a rare cancer in the blood vessels. It's called angiosarcoma. It's very rare and aggressive, but we'll do everything we can to help you. 6 months later, just before Christmas, I drove Ellinor to the hospital for a session of radiation therapy. With my support, she could hardly walk, but she managed to walk to and from the car. From the corridor where I waited, I heard her scream when the treatment began. Moments later, a hardened doctor came out and asked me to sit down. She said, Magnus, Ellinor's breathing indicates that the disease is in its final stages. I understood that she would never come home again with me. Thanks to decades of research, fantastic research, we've seen extraordinary progress in many cancers. For breast cancer, the most common among women, the 10-year survival rate has climbed from 58% in 1980 to 86% today. For prostate cancer, the most common among us men, it has risen from 37% to 88%. That is nothing short of remarkable. It's a testament of what science, funding, and data can do when they're aligned. But for rare cancers, like sarcoma, survival rates have remained almost unchanged for 40 years. 40 years. That's not just a statistic, it's a failure of our system, of our priorities, and of our collective responsibility. Sarcomas account for only 1% of all cancers. Angiosarcoma, which Ellinor had, makes up only to 1% of all sarcomas. So you'll understand in Sweden we're talking about 2, 3, maybe 4 cases a year. Before it touches your life, you likely haven't heard of it. You don't know anyone who's had it. Even most family doctors go through their entire career without encountering a single case, a single person. Sarcoma sometimes is called the loneliest cancer, and it is. You see pink ribbons everywhere and mustache campaigns. That's great. But for sarcoma and other rare cancers, silence. You feel forgotten, alone, and that loneliness is a wound of itself. This is why I think this project matters and why I say gladly, finally a project that sees the patients behind the numbers. Finally, an initiative that recognizes that data, when shared, structured, and used, will save lives. I've been quite worried lately, and that's for a good reason. First, when GDPR replaced Sweden's Personal Data Act, I saw not progress, but a step backwards. I must admit I was fighting for the European Union, that Sweden should be members. But it should not be, but that should be enabling collaboration, not creating barriers to communication in healthcare. Second, in Sweden only, we are drowning in fragmented systems. In one region, I won't say the name, but it's what you call here in Gothenburg the backyard of Sweden. In that region alone, we have more than 7,000 different healthcare IT systems who can't communicate with each other. In their wake, a sea of registers, forms and documentation, bureaucracy that has, in some cases, become its own career path. That's not healthcare, it's inertia. Third, healthcare and research are still stuck in silos. Here in Sweden, just look at SciLife Lab, a world-class research hub where questions can be asked from a scientific point of view, but not within the care system itself. That's not just inefficient, it's absurd. So it's time for action and to point out what the challenges are on a European level. We can start only in Sweden. We become excellent in this country at collecting data, but we failed at structuring it and using it. It's high time for a common national framework for data extraction. As I see it, we have 21 separate interpretations, one for each region in Sweden, of the law. Healthcare cannot afford this kind of fragmentation, not in an era where data can mean the difference between life and death. Third, democracy is a cornerstone of our society. But it must not become an excuse for inaction. Alla ska med, I don't know how to translate it in English, is a nice political slogan, but it costs life. When it comes to patients' data, it's time to take responsibility and action. Time to take a stand. I believe the privacy debate is, in many cases, overstated. I never met one single sarcoma patient or their loved ones who wouldn't willingly post their entire DNA sequence on a public billboard if it meant a chance to help themselves or their loved ones. Equal care, a phrase we so often repeat with pride, must also mean equal chances of survival in the future, no matter what kind of cancer you have. This project, handled right, I think, can become a model of how rare cancer patients are no longer left behind. It can be the beginning of the end of the loneliest cancer. Let's make sure it is.